Joint pain can sneak up over time, making everyday activities like walking, climbing stairs, or even putting your shoes on more difficult. Today, we're joined by orthopedic surgeon Dr. Dominic Van Nielen from Proliant Surgeons Everett Bone and Joint to talk about the signs of hip and knee arthritis. Thank you so much for being here today.
Thank you so much for having me. I appreciate it.
So let's talk about first what you specialize in and the types of patients that visit you.
Yeah, so I'm a joint replacement doctor, so I do hip and knee replacement. So I take care of a lot of patients that have arthritis. So that's the loss of cartilage or degeneration of our joints that happen over time.
Okay, and let's talk about arthritis. What is something that surprises patients about hip arthritis?
I think one of the big things that comes up when patients come and see me is that it doesn't always hurt where they think that it's going to hurt, right? When people come in and for a hip pain evaluation, a lot of times when I ask them where it's going to hurt, they say, oh, it hurts on the side or maybe back in my buttocks. But hip pain is really groin pain because that's really where the ball and the socket of your hip are. So a lot of times patients will complain of pain deep in the groin with walking for a long period of time or when standing up after being seated in a seated position for a long time.
Yeah, and when should someone get evaluated? Because I don't know if anyone's like me, but you know, you're always kind of feeling a little pain and you're like, I'm fine, just push through it. So when do we come to you? I
think when that pain gets to the point where it's significantly affecting your activities of daily living. So when there's things that you're not doing anymore because that pain sneaks up on you. I mean, people are very good at avoiding things that hurt. Right?
Yes.
And when I'm talking to patients in clinic, a lot of times it sounds like they're doing okay, but in our conversation it starts to come out, okay, maybe they haven't gone on vacation for a couple of years because they're worried that their hip or their knee is hurting, or maybe they're not playing with their grandchildren anymore, or when they're walking their dog, they're only going for a block instead of for a mile or so. And those things have a way of sneaking up on you.
Definitely, and I want to talk about knee pain. I have a lot of people in my life that always complain about knee pain. Sure. What should they know about knee arthritis?
I think the biggest thing, so the knee has 3 different compartments. All 3 of those compartments can develop arthritis over time. The inside compartment tends to be the one where we see it the most, but it's another one of those symptoms where when people have pain after being seated for a long period of time, that can really be significant for them, and it can sneak up over time.
Yeah, for sure. And so what are some non-surgical treatments to think about before going the surgery route?
Yeah, so we always try conservative treatment first. So that's generally things like physical therapy. We do a lot of corticosteroid injections. So that's medicine. Yeah, so it gets injected inside the knee, kind of calms down the inflammation that occurs with the degeneration of cartilage over time. We're also starting to do more PRP injections, which is a kind of regenerative medicine where we use the body's own growth factors to calm down inflammation and treat the pain that comes from arthritis.
Wow, we've come a long way. This is all very interesting. How do you know too when it's time to go beyond that and you might need a knee replacement, a hip replacement, and you've gotten to that level?
I think primarily, certainly when you come in and see us and we get x-rays and the cartilage is completely worn down in the joint and it's bone on x-rays, that's a good time to at least consider more treatment. But I think more importantly, it's based on your symptoms. So once again, when things really start to degrade to the point where you're avoiding things that you really want to do, that's where it's time to, and conservative treatment is not helping, that's when it's nice to consider surgical options.
Definitely. What does recovery look like for either one of those replacements too?
So surprisingly easy. At Everett Bone and Joint, we have our same-day surgery center. So a lot of even joint replacement patients are able to go home same day. In general, hip replacement patients tend to recover a little bit faster than knee replacement. But you go to physical therapy afterwards. Patients are walking the same day, even after a hip or a knee replacement. We're doing a lot more robotic technology as well now. So, that technology is fantastic because it allows sub-millimeter accuracy in our cuts. So we have to do less soft tissue release, and that can translate to easier recovery as well over time.
Okay, and what makes your approach so unique to patient care?
I think the biggest thing is that I really try hard to not dictate the care to my patients. I really view our relationship like, it's a team where my job is to talk to them, explain their diagnosis, give them the treatment options that we have, and allow them to make an informed decision on how they want to proceed, whether that's conservative or whether that's surgery.
Makes perfect sense. Thank you so much for your time, doctor. We appreciate it.
You're very welcome. Thank you so much for having me.
Yes, and for more information about ProLiant Surgeons Everett Bone and Joint, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by ProLiant Surgeons Everett Bone and Joint.